Autism rarely occurs in isolation, and understanding the additional health challenges that many individuals face can help us provide more compassionate and effective support. So, what are the common comorbidities that we may encounter with our learners, and what are their behavioral implications? Hi, I'm Shira.
And I'm Shayna. We're behavior analysts who create weekly content about how to teach children with autism so that they make real progress. And we create shareable resources to make your job just a little easier. Today's topic is all about common comorbidities in autism. And if you want more videos like this, make sure to subscribe and hit the notification bell to stay updated on new video releases.
So back many years ago, when we were starting out in the field, we worked primarily with individuals with autism, and it was a lot less common to have a child with autism. Rates have skyrocketed, but I think also it's a lot more common that autism is only one of their multiple diagnoses, that there are other things going on. There could be, medical challenges, there could be other diagnoses that come along with that autism. And so it kind of changes the way that we are creating our interventions.
Absolutely. So I guess the first question is, what are those comorbidities in autism and what does that actually mean? Well, comorbidity itself is just really two reoccurring diagnoses happening at once, and maybe they're undiagnosed, but there's two things happening at once or more than two things. They're really about, additional conditions that happen alongside of autism.
And they could overlap, meaning like they could present with similar symptoms, and some of those are different symptoms. But if you kind of think of a Venn diagram, like some parts of them overlap and some parts of them don't. But they both affect the individual. They affect either their physical health, their mental health, and their quality of life. So it is important to understand, while we're not treating a label, it is helpful to know what those physiological or biological components are going to be that are affecting behavior.
So in this podcast, we're going to get into a little bit more technical of like, okay, here's the common comorbidities, here's what they are, here's kind of what their symptoms are. We are not medical doctors, so we're going to not really gloss over, but we're going to not really, just really in surface learning things, not really go into too much detail. But if you want more detail, Dr. Google, no, seriously, consult a medical professional about this. And then in our next podcast, we're going to be talking about why understanding these comorbidities is so important and some of the things that you can be doing in your teaching.
So one of the common ones that I see very often is anxiety disorders. We have a whole podcast on supporting learners with anxiety and ADHD, which is episode 192. Symptoms of anxiety are like, that the worry avoidance behavior. If we're talking about it behaviorally, it's not even escape. There's no EO, and they're just avoiding anything that could potentially bring an EO. Some rigidity, difficulty with transitions, and so that really shows up with a lot of behavioral challenges. Sometimes it could be meltdowns, it could be a lot of rigidity or certain repetitive behaviors that they're using to manage their own anxiety.
And I have to say, Shira, I love that we're talking about this because anxiety is real. And I know that people didn't talk about it years and years ago, but it is real. And, it was one thing for us to say, oh, I'm getting anxious, and another thing to have a full-on anxiety disorder. And I've seen individuals who have a full-on anxiety disorder, and it is heartbreaking because these skills that they, can do some of the time they just can't because they're just not regulated. And it's really difficult for them to do a lot. They just really shut down in specific situations. So it can be really challenging, but also really good to know that they have this happening at the same time so that you can tailor your treatment towards it.
And it's important because we think of behavioral interventions as like reinforcement and shaping and all of those great skills that we're using. But if it's a can't do and they're in a place where no amount of motivation can get someone out of a panic attack, really, or some anxiety provoking situation. So we have to consider that this might not be a situation where we can motivate them out of. So it's important to acknowledge that it does exist.
Absolutely. Another common comorbidity is attention deficit and hyperactivity disorder, or what people refer to as ADHD. And again, it can be diagnosed, it can be undiagnosed, but a lot of symptoms involve impulsivity, that hyperactiveness, or that inattention. Sometimes we say it's that lack of executive functioning, right? The lack of planning and organization. If a student walks into a room and they leave, it's like they left a tornado behind. A lot of inattention, and I've already said that. And those are the symptoms, but some behavioral implications of that is that it can be really difficult to follow routines because, it's very difficult for them, not necessarily to get from point A to point B, but to actually get, plan, organize, get all their stuff going from their locker to their desk can be really difficult for them. Lots of frequent distractions, trouble with task completion. Those are all some behavior implications of ADHD.
And we talk about often if like these executive functioning skills, can really be taught, or can someone's executive functioning level be changed? I think at a young enough age, if we're focusing on behaviors that we want to see more of, teaching them to tolerate waiting, teaching them to initiate tasks, to follow routines, those are really great skills that we can focus on and without focusing on the label. And we can also work on different supports or strategies that we can teach our learners to use. If they may always have trouble with executive functioning, can we teach them to use a calendar or a schedule or something that could help support them? So it doesn't mean, again, that it's just going to become, mentalistic where, well, they have ADHD, so I guess they can't follow instructions. No, it's going to be how can we best support them in the behavioral implications of this?
And I think that's really important to note is that sometimes we get into these circular arguments of, oh, well, they'll never be able to do that because they have this diagnosis, whether it's ADHD or something else. And then they say, oh, well, they have this diagnosis, so they can't do that. And it's just this circular argument. And we've got to get out of that. And I love, Shira, that you say, if we can know this and recognize this early, we can teach some of those early waiting skills, or not waiting, but early executive functioning skills. And Dr. Alan Schnee and I actually did a series of CEUs on a course on early executive functioning. So it's not about, okay, well, my kid's 8 and has executive functioning, difficulties, but it's like, okay, at a 3-year-old level, what are the skills that I can teach to try and help them early, early, early? So you can check that out as well.
It's pretty common that a lot of students that we work with will have GI or gastrointestinal issues, which comes up as constipation, diarrhea, abdominal pain. Often that the implications for behavior are really like, think about how you feel when your stomach's hurting. You're going to be irritable. You might be refusing to like eat certain foods. It comes up a lot for us when we're working on something like toileting, and we're not sure like why it's not working. And sometimes an underlying reason is constipation. So always thinking about, ruling out some of these medical components if you're seeing some of the behavioral implications.
For sure. And, for some of our kiddos who can't talk, it must be so well, it's so painful for everybody, but, for those who can't talk, they can't say things. So if they're having behavioral challenges, like Shira said, it's so important to get that checked out. Another comorbidity might be some kind of sleep disorder. And it really does mean difficulty falling asleep, or maybe they do fall asleep, but they wake up frequently, or they wake up too early. And it's just really that poor sleep quality. And not only does that affect the learners we work with, but it also affects their caregivers. So, its behavioral implications can be just that they're tired all the time. And I know you're probably listening going, I'm tired. We're all tired all the time. But no, in all seriousness, though, like, they're just like, moody. It could be mood swings because of poor sleep, right? It could be difficulty concentrating, increased sensory selectivity, that type of thing as well, because they're just tired. And, you try and, look at some type of intervention, or you talk to the caregivers about parent coaching, and the parents are just so tired as well from being up with their kiddos that it's really difficult all around. So it has massive behavioral implications.
And also knowing that a lot of kids with autism do struggle with sleep, and they either don't produce melatonin in the right amounts or they have melatonin resistance. And knowing that will change our intervention, because sometimes our kids will need, extra movement before bed, or extra sensory input, or certain routines that we'll put in place that we may not do if they didn't have a sleep disorder. So it is important to know that when treating something. And sleep is one of the things that we would look at first before even moving into other behavioral interventions during the day, is how is their sleep, because it's so important for, effective behavior.
And sometimes if you can fix the sleep, fix the eating, those are the two things I think I look at. I do medical first, and then I'm like, okay, sleep and eating. Because if you can fix those, sometimes the behavioral things just go away because they're not tired anymore and they've got more tolerance for other
Works
things.
for me when I'm tired and
Just
hungry.
go to sleep.
Just don't even. Okay, so another one that I see pretty often is students with autism will sometimes have epilepsy. This is a seizure disorder. It could be seizures of varying intensity and frequency. It could be very often. It could be a big one, not very often. Um, but there are a lot of implications for that, and that is, the kind of confusion that and the tiredness, the fatigue after a seizure, the things that they may not have control over. That has this seizure affected other parts of their body, that their processing speed slows down or their response time, their emotional changes. Like it's hard, and it's hard on a person's body emotionally, mentally, physically to go through that, and so taking that into consideration is super important.
We also sometimes see skill loss with seizure activity, and that can be really scary too because, your data show, hey, look, they've got functional communication, or, hey, we've been teaching them this, and then sometimes you have to take a few steps back after they've had a seizure. So definitely something to keep in mind when you're teaching.
Sensory processing disorder is a over or under responsiveness to sensory. So those are the kids who, respond very strongly to touch, or don't like certain textures, or who don't like noise, or need, certain pressures. It's all of that, and we do take that into consideration because they may show us that they are avoiding certain things. So it could look like escape when really it's just too loud. Like they don't like going into that room because it's overwhelming. Or they may be seeking certain behaviors. So they may need certain sensory input. It could be, a vocal stim. It could be a certain movement that they're seeking. And they should be able to access that really non-contingently if it is something that their body is needing.
In those situations, I try and access an occupational therapist as much as possible just to get some ideas and some fresh ideas because it's not a one size fits all solution. If one person is sensory seeking and needs deep pressure, the deep pressure that they're seeking might not be the same as another individual who's seeking deep pressure. So it is really important to get another professional involved if you've got someone who presents like that. Um, Other things would be like mental health disorders. And I know that everything can be considered a mental health disorder, but I'm thinking specifically like depression, right? So you think of the symptoms of depression and you think of persistent sadness and loss of interest in things, changes in appetite. I mean, these are all symptoms of anxiety as well. But, if people are withdrawing because they're depressed, that has massive behavioral implications, right? So, no motivation in the world can change. Well, you're depressed. Okay, well, let me give you 10 tokens and then you can have this. Like that's not going to change that. So really looking at that, right? Because, withdrawal, it's real, decreased engagement in preferred activities. There might be increased aggression. Like there's a few things that go along with that for sure.
But back to, avoiding that mentalistic approach is it doesn't become the description of, well, they're not engaging in any, physical activity because they're depressed. And we end it there. And that's what we don't want to do. But it's true, they may be struggling with depression, but at the same time, what can we use that is within their skills? So it's within their can do, but maybe they won't do. And then we look at things like ACT and values-based approaches and things that work on some of the private events, or what kind of setting events are happening that are bringing out depressive thoughts or depressive actions, and thinking about it in that way, as opposed to only looking at it as the end of the conversation.
Yeah, absolutely. Other things can be things like learning disabilities, right? And there's a variety of learning disabilities, but some of those symptoms would be things like challenges in reading, writing, math. Some of those academic skills can be really lacking if someone has a learning disability, and it doesn't mean we shouldn't teach that. That double negative, right? We need to be teaching academics. We just need to be aware that they have a learning disability, so they will have unique learning challenges, and we need to be able to teach in a certain way. But some implications of that would be things like frustration. Lots of these individuals will try and avoid academic tasks, or they may even have a low self-esteem because they think that, they're stupid. I can't stand that word, and it's heartbreaking to hear people say it, but I've heard it before. I'm stupid. I can't do this. And it's really difficult. And we really do need to change our teaching.
Yeah, so we'll adapt a lot of the curriculum for a student like that. It's not, again, about just offering more motivation. If they can't do it, then we have to change the way that we're teaching.
Absolutely. Another one would be medical conditions, and we could spew off a whole bunch of different medical conditions from really severe to, really mild. Like, but I'm even thinking things like allergies or asthma. If someone has seasonal allergies, that's going to affect the way you're doing programming, or that's going to affect probably some data. Like if I'm sneezing all the time, not because I'm sick, but I've got allergies or my nose is all stuffed up, I'm definitely going to present differently than when I'm not, when I don't have those allergies.
And taking into account lots of absences or discomfort, when kids do have a lot of history with medical procedures or being in and out of hospitals, like we do need to take that into account. So
Yeah.
what does that mean to take it into account? Like what are really the behavioral implications and the strategies? So the first thing is you do want to look at the environment, and we've included an antecedent log here so that you can continue to track what are the antecedents that are triggering some of the behaviors that we want to look at. We also want to make everything individualized and adjust our strategies and our goals that would work for that learner and their profile and the things that they are struggling with.
And that's huge. You don't want to just fill in check marks on an assessment or, I'm going to tick off these boxes because this is what I need to check off next. It's really about, okay, how does this learner learn best?
And adjusting for the can't do's and the won't do. So changing the expectations. If it is a can't do right now, instead of trying to keep at it, if it's something that's not within their competence right now. And when it does become a won't do, then you can look at other factors that help motivate them.
But we talk about things not being within a kid's competence. What about our own competence and looking at that as well? And if it's not in your wheelhouse, get help. Even if it is, seek out a multidisciplinary team for support. Because as behavior analysts, we don't have a magic wand for everything, for something, sure. But no, we don't. And we really do need that extra insight.
And then, as we always do, just continue to monitor, have the data, and make changes when needed. And that's really what the data will tell us is what we're doing working? And if not, what can we do? What can we do different?
Absolutely. And I would say the last thing would be the communication piece with families and making sure that we are always communicating with multidisciplinary team. How many times can I say that fast? But also with the families and making sure that, we're all on the same page with things.
So, in summary, we discussed today some common comorbidities that your learners may face and some of their behavioral implications.
So click the link in and around this video to get your free antecedent log.
For more information on common comorbidities in autism, click the link on or around this video or in the description to claim your free antecedent log. We also encourage you to subscribe to the channel so you don't miss any future videos, and leave a like and comment below if you have further questions.